There is one similarity between all of us here on this earth. We are alive. Our hearts are beating, we have air in our lungs, and we have all been given a chance at life. There are millions of others, though, that are not given this same chance. This is due to abortion. Abortion has been a constant controversy for many years. The definition of abortion given by Oxford Dictionaries states that it is the deliberate determination of a human pregnancy. In 1973, abortion was legalized because of the decision made in a case known as Roe v. Wade. Because of this case, millions of lives have been affected. Guttmacher Institute is known for giving statistics every 3 years on abortion in the United States. Since the Roe v. Wade case, there have been about 60 million abortions in the United States, and in 2014 alone, there were over 920,000 abortions performed. In the graph that I have attached into my documents, there is a graph that shows the number of abortions per 1,000 women aged 15 to 44. It shows the years from 1973 to 2014 and these number of abortions. These numbers do show a decrease in the number of abortions each year, but there are still too many lives that are being taken by abortion each and every single year. Next, I want to go to the table that compares abortions to other causes of death. Many people think that the number one cause of death is usually cancer or heart disease, but in reality, this table shows us that abortion is the number one cause of death in the United States, and this is from 2016. These numbers are way higher than any other type of cause of death. Many people believe that pro-life individuals are not respectful of others' opinions. They think that we as individuals do not accept people for what they think or what they believe in, but really, we are just concerned with all lives. This includes those mothers and also those children that are not being given a chance at life. I want to discuss the different viewpoints of both pro-life and pro-choice individuals to help each of us make a more educated decision as to what we believe is the right way for every woman and child. I first want to begin with what pro-life individuals believe. Pro-life individuals believe that every life is valuable. Everyone deserves to live this life that they have been given. They also believe that life begins at conception, so any baby that is taken through an abortion is considered a murder. Although many people feel that when life begins is a debate, there is not much debate when scientists have made it clear as to when life begins. LifeSite News shares that scientists have agreed that when a sperm cell from a male penetrates an egg from a female, you have one cell with the complete amount of genetic material needed for everything a human could ever want to do. Pro-Life Across America also shares that 18 days from conception, the baby's heart begins to beat, and 28 days from conception, a baby already has eyes, ears, and even a tongue. This means that when many mothers are going in for an abortion, this baby has already started to develop and this body is forming. These children should have a right separate from their mother. Abortion activists often use the slogan, "My body, my choice." The thing that's wrong with this slogan is that each baby has its own genetic code, which is unique of the mother. Because it has its own unique code, it means that there are two different bodies in there, which means it's not just my body, my choice, because there are two bodies, which should mean two choices. This is also shown in the United States, as women cannot be executed if they are pregnant, because the child should not be punished for what the mother committed. Also, if a mother is murdered while being pregnant, the felon is not just convicted of one crime, but actually two crimes. Before I explain what pro-choice individuals believe in, I want to explain the different types of abortions and also side effects that come from having an abortion. Advice and Age shares different forms of abortions that women have. The first one is called a vacuum aspiration. This is when a local anesthetic is injected into or near the cervix. That cervix is then stretched to put a tube inside, which then suctions out that unborn baby and placenta. Many times, though, they have to go in after the procedure to scrape the walls of the uterus to make sure it is completely empty of the child and placenta. Another form is called dilation and evacuation, also known as D&E. In D&E, there are sponge-like pieces of material placed in that cervix to help it open slowly over a period of time, which can take several hours or even overnight. This can be a painful situation to be put in, which is why medication is often given, and also to help prevent those infections. A general anesthesia is also given to the mother, and then the unborn child and placenta are removed with forceps and suction. Oftentimes, though, it is necessary to dismember that unborn child, which means to cut it into pieces and remove those pieces one by one. Lastly is a non-surgical or medical abortion. This is when a drug is given to stop the development of the pregnancy. Although this may sound simple, it can also cause a lot of issues for women that they have to go through afterwards. Some of these may cause cramping, pelvic pain or bleeding, and oftentimes women will pass clots and tissues before they can even pass that unborn child, which can take hours or even days. There are many side effects that come after the women have these abortions. American Pregnancy gives a list to help women understand what they may have to face later on. Some of these include hemorrhaging, infections, inability to get pregnant later on, pregnancy loss, an increased risk of preterm birth in future pregnancies, and an increase in the possibility of breast cancer. Others include anxiety, depression, alcohol and drug use, and suicidal behavior. The hardest one is maternal death rates are significantly higher after abortions than for mothers that have childbirth. Pro-choice individuals believe that women have the right to choose, and it is their fundamental right to make that decision. Planned Parenthood uses this sentence often to help women feel okay with what they are doing. It says, the decision to have an abortion is personal, and you as the mother are the only one who can make it. Many times, pro-choice individuals think there needs to be more done for those that have fallen into the group of unplanned pregnancy. They also believe in prevention, which is supporting abortion and reducing the number of unplanned pregnancies. They believe as they support abortion, they're able to help women not have unplanned pregnancies, but that women can be prepared when they have those pregnancies, although they were the ones that got pregnant unplanned. And now the baby has to suffer because of their decision. Through all of this, I'm just asking that you take into consideration both sides of this argument when deciding which one you agree with. It's all about making an educated decision and knowing what pro-life and pro-choice individuals believe in. With a controversial topic such as abortion, both sides are going to have arguments defending what they believe in and what they stand for. For those that are pro-choice, abortion is that answer. But for those of us that are pro-life, there are other options out there, and one of those could be adoption. When considering both abortion and not having one, consider educating yourself and understand why pro-life is a better way for all lives.